Odin presents Real Talk when intent meets impact in learning culture. Real Talk is designed to create space for honest conversations about the challenges facing nursing education. The views shared in this episode are those of the speakers and participants and do not necessarily represent the official position of Odin.
Hi, everybody, and welcome back to Real Talk. We are happy to be here with you today. If you've been with us over the past few sessions, you know that we have had an ongoing series about incivility. That was a topic that kind of took on a life of its own. And sadly, it sounds like there are many of us that are working in situations that incivility is around us, or we have noticed that. But we wanted to bring another topic to the table today because just like real talk about incivility, we need to do some real talk about some other parts of incivility or that feed into that. So today, Nicole and Claudia and I are happy to be with you, and we're going to talk a little bit about a topic that sometimes people don't want to broach, but it's very important that we do. And that's microaggressions and how they show up in nursing education. Basically, these are the little things that leave a really big impact. Now, most of us have heard that term microaggression before. It's often very much misunderstood. We're not here today to label anybody or any person as a good person or a bad person. We're here to bring common understanding and open that topic up about how sometimes small things that are said can influence the way that we interpret each other or that influence learning or our ways to work together or belonging or even our professional development.
Yeah, I think this is a good discussion to have and for us to remember that as educators we have tremendous influence. And this is a topic that we were just discussing is kind of like an undercurrent to the bigger issue of incivility. Microaggressions can absolutely be incivility and can certainly lead to more issues. But I think a lot of times they're just this undercurrent that can create an environment that's ripe for a poor culture to develop or to create an environment where perhaps things are accepted that just shouldn't be. And again, this isn't to label people as good or bad. Sometimes we remember what we remember saying isn't what a student remembers hearing. And really looking at how we interact and the words that we choose is important. And other times, I think it's important to realize that microaggressions occur even though there may be good intentions. It's just not recognizing the implied meaning that may come along with some phrases that maybe have been used historically and they've historically been okay and they're not okay. And bringing that to light. So let's start today by just kind of defining what is a microaggression. So, Sherry, do you want to define that for us?
Sure, this is not our definition. This is simply an aggregate definition that says that microaggressions are subtle verbal, behavioral, or environmental messages. And they can be intentional or unintentional, like Nicole said, but they communicate bias, exclusion, or negative assumptions about another person. So keep in mind here that the intent of what somebody said doesn't necessarily yield the impact. So you can say something with a good intention or actually with no intention of harm, but that comes across and the impact is still there. So here's a few examples of them. And I think we can all add some of these. Like the first one I'm going to give here is, you don't look like a nurse. What does a nurse look like? And who decided that? Who said that a nurse looks a certain way? Another one that kind of goes along with that, and I know I used to hear this, Lord knows I don't hear it anymore, but you look too young to be a nurse. You look just like a baby. And so somebody says that, and that makes that nurse feel very unseen. Nicole and Claudia, what are some others that you have heard?
Um, Gosh, one that I hear a lot is you speak English very well. And it's meant to be as a compliment, but the insinuation is I didn't expect, based on your appearance or based on your culture, that you would be able to speak English. So That's one that I hear frequently. Um, or you're too sensitive. You really just need to get over yourself. You're just too sensitive.
Claudia, what have you seen? I know that you have an experience with some of your students that you mentioned earlier to us that really brought some of those things to light too.
One thing that I've heard is when if somebody's from a different religion, maybe someone saying, "I just don't understand all of the holidays," or maybe often I know with my students, they just really think that the only cause of obesity is overeating. And of course, there are a lot of people in my family that are overweight, and it's like, no, guys, that's not it. And then of course we do critical thinking to discuss it, but if you just say, oh, well, if you just don't eat as much, or if you go to the gym more, those are
Right.
some ways that we can spread a microaggression where we mean well, but is it really the cause? Is it helpful? Is it supportive? It's not.
Right.
Agree. And you mentioned something earlier, Claudia, when we were all chit-chatting that I'm going to borrow, but I want to give you credit for it because I think this is really important. When people say something like, oh, I'm really surprised you handled that so well as a woman.
Mhm.
So even gender or sex can be something that is the root of, or a target, I should say, of a microaggression. How many times have we heard that? Maybe not ourselves, but in society, sometimes we hear things and it's like, well, a man would have handled it this way, and a woman would have handled it that way. So I was surprised when she handled it that way, or they say she handled it like a man. So those
Mhm.
things are microaggressions, whether we have thought of those in the past or not. Sometimes people get caught up thinking microaggression is only about race and culture. And although
Exactly.
that is part of that, there are many other types of things that feed into microaggressions. Not always are they meant, like we said, to be malicious. They're malicious. They're often just these automatic either responses, and sometimes people say things just to fill the space, or it's an automatic assumption that it'll be taken well on the other end. And unfortunately, there are times that there are people that do intend to
Mhm.
hurt. Mostly by and large, microaggressions are not meant to, but there are times that sometimes people will do that with an undercurrent because they know that they may get a reaction from someone. So anyway, microaggressions can be true whether we are talking about the way that faculty relate to students. It can be true whether students are relating to faculty. That's not the part we're going to unpack today, but definitely faculty to students and faculty to faculty interactions. We can see those in different places. So why should nurse educators care? Nicole, you want to pick up there with what these things affect when we see and hear microaggressions?
Yeah, absolutely. One of the things that we've talked about repeatedly as we've moved through this podcast on civility is an environment of psychological safety. And having microaggressions as that undercurrent being something that's either fostered or allowed or not addressed or not taught what it
Mhm.
is doesn't promote that psychological safety that we need to develop in our classrooms because we know from evidence that when we can create environments that promote psychological safety, that our students can learn better. It's the same that's true with faculty when we have faculty bodies that can work well together that are psychologically safe. They have a better working experience and they have more longevity within the profession of nursing education. So, really creating that environment of and help foster that environment of psychological safety is huge. The other thing is creating a sense of belonging, and I think that's part of creating psychological safety, where everyone is seen for who they are, and
And
recognizing that
respected.
seen and respected and valued for who they are. And just creating a willingness to ask questions. I would much rather ask a question that maybe seems uncomfortable than make a statement that would hang with somebody um, for years. I gave an example when we were kind of discussing this earlier. And this is an example that is totally unrelated to things that you would normally perceive as microaggressions. But I am an adoptive mom. I adopted twins when they were born. And I had obviously had been home with my twins, and I came back to work, was nursing educator. And one of my colleagues came up to me, very well intended, and she asked me if I was granted maternity leave like a real mom. And my girls, my twins are 20 years old now, and I still, to this day, remember that. And it was not her intent. It's kind of like we go back to this question of intent versus impact. Her intent was she wanted to make sure that I was taken care of, that I had received maternity leave. But her impact questioned the reality of my motherhood with the children that that I was given, that were my children. These were my children. So and those are the type of things. That's a kind of a different example when you think of microaggressions, but things like that where the intent may be one thing, but the reception and the message behind the reception is it's extreme, and that's the type of thing that, I use the phrase all the time, when we know better, we do better. And I think that's what lends us toward creating psychological safety in our classrooms. And it's why I think nurse educators have to care. And we've talked about civility with addressing it when it happens, when incivility occurs. But if we allow the undercurrent of microaggressions to continue without addressing them, that's just a way to keep that level there, that current there that could foster that culture. So,
Nicole, I want to capture something
sure,
you said there just because we gave a
sure,
couple of examples earlier and we talked about when people say things like that, like I don't see color or things that it's apparent that it is. We talked about that devaluing the
yeah,
person. What happened to you is the same exact thing. They didn't see you as the person you were, which is the mother of the child.
right,
So this can happen in any capacity. And a lot of the microaggressions are not seeing the value somebody brings to the table. Oh, I can't believe you're going back to nursing school at your age, just as if you don't have something to offer the profession because you're, quote, old. Or we talked about the person that's very young. Oh, you couldn't possibly be a nurse because you look like a baby. Any of those things take away the value of who that person is at the core, and I think that's what we need to capture in this conversation is microaggressions, because I don't think that most nurse educators want to devalue people. I really
no,
don't. We've always said there's always one out there who's going to behave badly, but we are talking about the majority. They don't want to devalue each other. They don't want to devalue students. They don't want to devalue just normal people within the human race. They want to do well, but ignorance of microaggressions often just perpetuates the cycle.
Something you all mentioned hit really close to home. You guys said that when we are careful with these words, the person is going to be seen, they're going to feel respected and valued. And what I think about is safe. Sometimes being African American, you have to think about, okay, am I safe? Is this a safe environment? I have a coworker who teaches mother baby, and she talks about high mortality rates in African American group. And when I found out that she did that, not only did I feel seen, respected, and valued, but I felt safe with her. So one of the wonderful things as a nurse that we get to do is we get to advocate.
mm,
Will we be able to advocate if our patients don't feel safe, if they don't
right,
feel valued, if they don't feel seen and heard? So I think this is a wonderful topic for us to talk about, because not only should we be able to see our peers as our coworkers, our students we could teach our students how to see people. So with
right,
these small examples, it can really make a world of difference, because I tell my student, if this patient doesn't trust you, no matter where they come from, no matter what they look like, they'll be having a heart attack and you'll never know. So,
Right.
but if they do know, they do feel seen and valued, they'll feel safe and they'll push that call bell, and
Yeah.
we can prevent some things from happening.
You know what's interesting about that is all three of us here are talking about valuing and being seen as individuals and our patients and our students and our co-faculty. It almost in a weird way is the antithesis of the way that many of us were taught in nursing. We treat everyone the same. Now, I understand the undercurrent of that. And what that means is we are going to be called to give everyone excellent quality, evidence-based care. I understand the undercurrent of we treat everyone the same. But also, there's that flip side of do we treat everyone the same? Because we need to understand there are differences. The maternal death rate, inexcusable. And it's been that way for quite a long time in the United States. Why is that? Because we aren't seeing what is right in front of us. So we have to be able to balance that with, yes, we do treat everyone the same from the perspective of commitment to
Right.
excellent quality, compassionate, evidence-based care, but we also have to look for those other things that make us unique or make our population unique because those deserve care too. One of my favorite creators is Jen Hamilton. I'm sure many of you have watched her. She's a nurse creator. And I think that is one of my favorite things that she says. And she says that a little bit tongue in cheek. She says, no, I never treat everybody the same. But she always goes on to clarify. She's a labor and delivery nurse. I try to treat everybody with the nuances that they bring,
Right.
whether it is statistics that have happen within their population, whether it's their feelings, whether they are frightened about a certain thing that nobody else would be frightened about. But I try to treat them as the person that they are in front of me. And taking that right back to trust, that makes it so much different than that nurse has just clocked in to do their job and then they clock out. You know what also that made me think about? This is a little tangent. Is it a microaggression when we label nurses as she and her?
Mm,
Because if you ever look at the literature that's out there, many times you will see that referring to the profession and referring to the people within that as she or her. And that is not the case anymore.
it's the nurse.
It is the
The
nurse
nurse.
because the nurse can be anybody. And that
Mhm.
devalues the other people that have chosen nursing
Mhm.
when we only identify nurses as women. So that's
Mhm.
just a little offside there. Why don't we move into some specific things? And I know we gave some examples that are probably part of this too, but let's move into some of the ways these microaggressions show up towards students. Again, reflecting on the fact that we are not calling people out thinking that they mean to do this. There are ways people can actually say something that is a microaggression about someone else's ability. For example, I didn't think you would do that well on that skill, or I didn't think you could do that well when you went in and talked to that person. You're smarter than you look, or you're
Mhm.
smarter than you act. And even though maybe underneath that there's an intention of building the student up, it's demeaned them at the same time.
Yeah, and I think we also will bucket students, like male students will, oh, well, he's probably going to work in the ER, or he's going to be a CRNA, like because that's, um, it's like we have that predetermined ideation of where male nurses may work as opposed to female nurses. And another one that I think about a lot, and this is one that I will literally Zoom with a student, um, say their name right. If I don't know how to say their name, I want them to teach me how to say their name because I want every student to know that they're seen and they're valued. And if I don't take the time to know how to say your name correctly, I mean, for me as an educator, that is the absolute very least that I can do is to be able to pronounce your name and say your name correctly. So please, that's one that we can really, really work on as educators. So.
Absolutely. It's even a one step worse, and I think we probably all heard it in different circles where people will say something like, well, that's just too hard. And then they want to assign a nickname or a
Oh yeah.
shorter name, which is inappropriate. You state the name that the patient gives you or the student gives you, and you use that name. Another thing that I think we need to include within this are policies, because, faculty are responsible for designing policies. Can we have microaggressions within policy? I would postulate that we can because I have seen policies in the past. Thankfully, many places are getting better, but they're not culturally inclusive. I think tattoos are one of the biggest ones right now. But one that really hurt my heart was seeing a policy about people's hair and it looking a certain way. You know, hair is hair is hair is hair. Different hair looks different ways. Different hair responds in different ways. Different hair must be cared for in different ways. And so, why are we putting policies out there specifically about certain people's hair when really all we need to be thinking of is infection control for all of us? Everybody needs to just keep your hair out of your face. It's not appropriate to do that. Another thing is touching people's hair or touching them when they may not want to be touched. That's not okay. Just as we think of that with patients, we need to think about that with students as well. So I think we need to challenge ourselves to think about our policies too, and whether they're inclusive. That kind of goes back to, well, you don't look like a nurse. Well, here's what a nurse needs to look like, and y'all can take this home. They need to be professional. They need to be compassionate. They need to be clean. And they need to be open, meaning open to other people. That's what a nurse looks like.
Yeah.
A lot of these other things, like do you have 7 earrings or do you have 2 or do you have 1? That's not necessarily what a nurse looks like. So I challenge all of us to think about that as we are responsible for making policies for students too, because that's a way it can show up.
I
What
love
about
that.
diverse? Oh, I'm sorry, Claudia,
I'm
go
sorry.
ahead.
I love that you mentioned that. I recently was responsible for being one of the editors of our policy, just looking over, making corrections. And I was surprised to see that there was a particular hairstyle in there. And honestly, I think it could have just been in there just because the people didn't know, and it just been
Right.
there, just it kind of had
Yes.
dust on it. So I
Yes.
just asked, can we remove this? And it was removed, and we went on from there. But it is, I like what you mentioned about making sure that the nurse is looking clean, kind, open, has some knowledge, and welcoming. But
Right.
besides that, we don't want to, because how important is it for our nurses to look like the community they're serving? How much
Absolutely.
better will our patients heal and feel
Yes.
heard and understood when they have someone, or even the opportunity to have somebody who looks like them?
Evidence shows that.
Hmm.
Same thing with teaching. All of our students need to see themselves
Yeah.
in other people that are teaching. They need to see themselves in nurses. Patients need to see themselves in nurses. And so we need to be welcoming to everyone because nursing is for everybody.
Claudia, I love what you said about that policy. It just had some dust on it.
Yes.
Girl, that is the truth. So if people listen to this podcast, if you don't take anything else home, it's that. Look at your policies, make sure they don't have any dust on them,
Dust it off.
because that is a take home point right there. And
Yeah,
I appreciate that message because that is so true. And
it
it's
is.
it goes back to, I feel like I'm a broken record. When we know better, we do better, and as things change, those policies have to be changed and
Yeah.
updated and dusted off. So I love that. I love that phrase.
Hey,
Um,
speaking of policy,
mhm.
we follow policy for accommodations with students. And some students do have accommodations for different things. Sometimes they're physical, sometimes they're emotional, sometimes they are ability wise, they have different abilities. Um, have we ever thought of the fact that microaggressions can arise out of accommodations? How many times have we thought about that? Like labeled somebody, maybe even in our own mind. And again, when we know better, we do better. Oh, well, they're just, taking advantage of testing by themselves or something like that. Have we ever labeled somebody like that? What about some of our neurodivergent students that maybe they don't make eye contact in the same way that someone else would? Have we ever labeled them that they don't have interpersonal skills or they can't relate to people because they don't make those eye contact things? What about the students that may have differences in physical abilities? I think we might have mentioned this on one of our earlier podcasts about a discussion thread that we've seen in just a group of nurse educators. And somebody was asking the question, well, I have a student that has some accommodations because they only have a portion of an arm, and they were asking for feedback, which honestly, again, if we don't take anything away from this particular podcast, we need to know that we observe the accommodations that are outlined by the institution's ability resources, or what do they call that? Student success resources, disability resources. We follow that. We don't determine how we do that. But the person had posted and asked, well, what do I do? Because this person only has part of their arm. And somebody actually answered and said, you tell them they need to get a prosthesis. That is definitely incivility. Now, there is microaggression within that, but I would almost say that's a macroaggression, even though I'm not sure that's a real word. But that is a judgment call that completely devalued the student, even though the student didn't know it happened. It happened in a forum of other nurse educators talking about that. So we need to think about that, because neurodiversity and abilities, meaning physical abilities, mental abilities, are different. But yet again, nursing is a place for everyone. Not every single person is going to be in a high stakes, at the bedside, ER, snatching people from the jaws of death position. There are places for everyone. And our job is to get the students where they are intending to go, to the very best of our ability. So I think we have to include those things within microaggressions as we talk about this as well.
So, as we think about our students in the clinical environment, sometimes patients will just come right out and say, I want a different nurse. How do we work with our students and teach them how to respond to that? Or even the staff on the unit might say, I don't want that student because they don't know what they're doing. They
Or
don't
they
know
don't
what
want students at all, any of them.
exactly.
They don't want to be burdened with any of them.
Right. Or the staff will talk to you as the nursing professor, but they won't talk to the student as the caregiver, as the nurse for that patient. So how do we teach our students how to address that? Because I think that yes, that can border on incivility, but some of those behaviors are often subtle, and can often be microaggressions with our students.
I
Yeah,
think,
sometimes it's not what they say, it's how they act, because I've heard students many times say, we just don't feel welcome on that unit. And
Right.
when you go there and you see that, you see the body language is
Mhm.
different. You see there's no interface, so it's a feeling. Claudia, I'm sorry, I think I spoke over you.
oh, all is well. I'd love to have the students ask questions. Sometimes with the students being new to the setting, they may think, oh, they don't want a student. I said, did you ask them? So if you ask them and they said yes, or or just like you said, the body language looked like a no, then sometimes I'll go in and just say, oh, and then if I feel like I'm getting pushback, okay. But I think it's always important to just ask a few questions. And maybe we do need to send someone else in, if it's a charge nurse, if it's the professor, just to go in and just say, hey, oh, hey, how's everything going? I love to put a little sugar on things. How's everything doing? Can I do anything for you? How's it going with the student this morning? And
Oh, great.
sometimes if you see if they're like, oh, I just, and some people are really nice about it because they don't want to not have a student, but they just maybe not feel well, or they just
Right.
maybe had a bad experience. And we have to
Right.
honor that as well. So sometimes a few questions will kind of help figure out. But I do love afterwards to discuss with the students, well, what happened? What do you think could have gone differently? How do you feel? And just kind of have a chat with them to let them know it's not their fault and that they
Right.
did what they were supposed to do. I try to give them compliments when I can, but sometimes it could be, like I said, a past experience from the patient, or they maybe could be having a terrible day. I mean, look where they are.
Right. Yeah, right.
Or they could just, I don't know, just maybe just not care for a student. So,
Same could be
Yeah.
said for the nurses on the unit. And I'm certainly not making excuses for them, because they're not there because they're sick. They are there because that is their role, that is the profession they chose, and they should be held to that standard. But sometimes every one of us is human. Every one of us is human, and we might have just caught somebody on that day where they just were ignoring something else because that's all they could process, or they might have said something and kind of snapped a little, but maybe that's not how that rolls on any other normal day. There's always exceptions to that rule, and one time shouldn't illustrate the way that that person is forever. You know, grace and accountability can coexist. You need to be accountable to not do that again, but we can give grace as well. It's when those things become a pattern. But I do think that that's important. Like you said, we address it in the moment with them, with the students. But if it happens again, I think we have to address that even at that unit level, if we happen to be in a hospital, so
And
that
I think
there's
it's
open
important.
communication.
Yeah, I think it's important because Claudia, you and Sherry both have really echoed this, the role of the clinical faculty member, and making sure that our clinical faculty address and become advocates for the students. And, as, Claudia, you verbalized, very well how you try to kind of smooth those waters. And that role modeling is the student learns from that. And there's so much value in them seeing the clinical faculty as an advocate. That's how the student learns how to advocate for themselves and learns how to advocate for their patients. So I think there's so much value in that. I think when we, kind of look at specifically when we witness something happening, like when we see a microaggression, I think the number one thing that we can do is stop and pause and ask for clarification. Did you mean that way? Or tell me what you meant when you said that, because that brings awareness to it, and that's not a threatening question, and it allows time for inquiry. So, like, I'm just gonna play, let's pretend like 20 years ago, 20 years ago, Nicole had said to this colleague, "Did you mean to devalue me as the mother of my children?" Or did you mean for that to feel hurtful, if I had said something back? And I would bet every dollar that I have that her answer would have been, oh my word, that is not anything like what I meant. So I think that opens those doors to having a better understanding so that people learn that their words have power and that the way words are used can either bring life or they can hurt. And I think that's a really important thing. So just that pause, seek clarification, and to ask. And then, Claudia, you already mentioned supporting the learner afterwards. When the student feels like, hey, that patient didn't want me because they said they couldn't understand me or something like that. And how do you support the learner in that and be their advocate for them? Um, so those are some of the biggest things. And in the classroom, we have to redirect when there are specific things that are happening. We got to call it out, pause, and redirect. And that's where we become the model for what do we want this environment that's psychologically safe to look like.
That's our responsibility to create that and to cull that over time. As we end up wrapping this up, it seems like this always goes so fast, but let us leave you with a couple of questions to just sort of roll around. I think that that's really good to go away and think about these things because this is a large topic. It's very important that we unpack this in our own minds before we even talk with each other about that. So I'm going to offer one question here. Nicole, I think you've got a question to offer here. Based on our conversations today, thinking in your own life backwards, what have you said at some point, again, not necessarily with any kind of bad intent, but that now you realize that could have been a microaggression? And what would you say differently had you known earlier?
And I guess the question that I would end with is what's just one practical thing that we can do tomorrow just to create a more inclusive learning environment? Claudia, we didn't we talked about this before, but I think a great thing to kind of to give an example, because to answer that question, what's one tangible thing that we could do? Would you share what you do with your students?
I got the idea to do a microaggression activity. I'll show a quick, maybe 2 minute video of what microaggressions are, what they could look like. You may think they could be on one particular group, but really, like it was mentioned here, it could be anyone could have one. And then I asked them to write down what something, a microaggression someone said to you. Everyone does it. I give them a moment, and then I ask if, and they already know they're going to have to talk with me. But I ask, would anybody like to share? And usually hands come up. And while you know what's been said to you in the past, it's interesting to hear what somebody else has going on. And you might think, like, oh, you're pretty for a guy. Oh, okay. Like, I never thought that that could be a microaggression. And like, oh, you should. One of my students said that once. So it's interesting. So I think that not only it allows the person to feel heard, I think it helps us with our community in the classroom. And I also think it helps us know what some of our patients may experience.
Right.
And each other.
Right.
Yes.
I love that you do that with students because they hear things with each other. Again, evidence shows peer learning can be just as effective as learning from a faculty member. They learn from each other how these things are perceived too. And I love that that is individualized to them because that helps them learn, I shouldn't say that, or I would say that in a different way because I don't want to devalue my peers either.
Right.
Yeah.
And, I think a great way to wrap up is I can't wait for this watch party. It's going to be a good one. But a great way I think is for us to think of is that it's very, very rarely just one comment. It's these things build over time and they can erode the environment or the culture that we're trying to create in our classrooms, in our schools of nursing, in academia as a whole, in our profession as a whole. And so I think that's why it's so important to address these things. So I can't wait till we have some more discussions when we do our watch party. And it's going to be a good one. So thank you all so much for listening with us, and we'll see you soon. Thank you, Claudia, for being with us.